Hi everyone, welcome back to Mid Inside the Hub channel. Today we are diving into an important topic, depression. What is meant by depression and what is the another name of depression? Depression, also known as major depressive disorder, it's called as also MDD, is a mental health condition that affects mood, thinking, behavior, and overall well being. It is more than just feeling sad or going through a tough time. It is the persistent conditions that can impact all aspects of life, including relationships, work, and daily activities. Symptoms: depression can manifest in various ways, and symptoms vary from person to person. Common signs and symptoms include emotional symptoms, persistent sadness, emptiness or hopelessness, irritability or frustration even over small matters, loss of interest in activities once enjoyed, anhedonia, feelings of ruthlessness, guilt or self-blame, thoughts of death or suicide. Physical symptoms like fatigue or low energy. In a whole day or night, you will not get any energy. Change in appetite or weight low, either loss or gain. Sleep disturbance, insomnia or sleeping too much. Aches, pains or digestive problems without clear physical causes. Cognitive symptoms: difficulty concentrating, making decisions, or remembering things. If you are going to take one decision, like major decision, where you will do the course or what your future goals, you can't take any decisions or you can't remember anything like important documents or everything important you can't remember. It's premises of negative thinking patterns, slow thinking speech or movements, causes and the risk factors. The exact cause of depression is not fully understood, but it is believed to be combination of biological, psychological and environmental factors. Biological factors: chemical imbalances in the brain. Example: neurotransmitters like serotonin and dopamine. Genetics: family history of depression increases risks. Hormonal changes. Example: during pregnancy, menopause or thyroid imbalances. Psychological factors: traumatic life events. Example: death of loved one, abuse or major life changes. Chronic stress, low self-esteem or a tendency toward negative thinking. Environmental factors like lack of social support, you can't get any support from the society, social isolation or loneliness. You are not attracting to the people and you are not talking to the people outside or inside your home. You are taking isolate with you. It's called as the social isolations. Living in an abusive or highly stressful environment. Like an example, you can take your parents are fighting all time. It's called as a highly stressful environment. So your teachers or your company will give so much work pressure. Diagnosis: to diagnose depression, a mental health professional will typically perform a thorough evaluation that includes the physical examination to rule out other medical conditions. Psychiatric evaluation involves discussing thoughts, feelings, and behavior patterns. Diagnostic criteria based on the Diagnostic and Statistically Manual of Mental Disorders DSM-5. Depression is a diagnosed if a person exhibits symptoms consistently for at least 2 weeks. Treatment: depression is treatable and combination of treatments may be used depending on the severity and type of depression. Psychotherapy, cognitive behavioral therapy helps to change negative thoughts patterns and behaviors. Interpersonal therapy focuses on improving interpersonal relationships and communications. Psychodynamic therapy explores the unresolved conflicts from the past experiences that may contribute to depression. Medications: we can give the patient to antidepressants such as SSRIs, selective serotonin reuptake inhibitors, or SNRIs, serotonin norepinephrine reuptake inhibitors, mood stabilizer for individuals with depression and mood swings. Antipsychotics in cases where the depression is accompanied by the psychosis. Lifestyle changes: regular physical activity, exercise has been shown to help alleviate depression symptoms. Healthy diet and sleep patterns, practicing mindfulness and relaxation techniques like meditations or yoga. Other treatments: electroconvulsive therapy (ECT), often used for severe treatment-resistant depressions. Transcranial magnetic stimulation (TMS), a non-invasive treatment that stimulates the brain. Ketamine therapy, emerging as a treatment for resistant depression. Types of depression: there are the several different types of depression, including major depressive disorder (MDD), the most common form of depression, characterized by the persistent low mood and lack of interest in activity. In this depression, patient will look like a lack of interest in all activities, like you are telling go there, they will not move at all, they will not listen anything. Persistent depressive disorder (PDD), also known as the dysthymia, it is chronic form of depression that lasts for at least 2 years but with less severe symptoms. Bipolar disorder involves episode of depression and mania, elevated mood or energy. Seasonal affective disorder occurs during the specific season, usually in the winter months due to the lack of sunlight. Postpartum depression occurs after childbirth and affects the mother's mood. Psychotic depression, depression accompanied by hallucination or delusions. Impact: untreated depression can significantly impair daily functioning, leading to social withdrawal, poor work performance, and an increased risk of suicide. It also linked to other health conditions such as cardiovascular disease and the chronic pain. Prevention: while there is no guaranteed way to prevent depression. Certain lifestyle changes and the strategies can help lower the risks. Building a strong support network, practicing stress management techniques like the yoga, meditation, regular exercise, and a balanced diet, seeking early intervention for mental health issues. When to seek help? If you or someone you know is experiencing symptoms of depression, especially thoughts of suicides, it's most important to seek help immediately. Consulting a healthcare provider can ensure appropriate treatment and support. Thank you, everyone. If this message resonated with you, don't forget to like, subscribe, and share it with someone who might need it. Let's break the stigma and build a healthier, happier community together. Take care, and I will see you the next video with new information. Thank you, everyone.